Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, then if you see the congenital diaphragmatic hernia diagnosis of congenital diaphragmatic hernia. So for the diagnosis of congenital diaphragmatic hernia, it is better to diagnose the condition prenatally. So prenatally, it is diagnosed with the help of a prenatal ultrasonography. But after the birth, that is in the postnatally, it is diagnosed by an X-ray. Postnatal diagnosis is mainly by an X-ray. Prenatally, we can use ultrasonography for diagnosis, and postnatally, the diagnosis is by X-ray, where we see presence of gastric air bubble and loops of the bowel are present in the thorax. So there will be loops of the gastric air bubble and the air bubble and the loops of the bowel will be found in the thorax. Okay, in congenital diaphragmatic hernia. Then that is one thing. And one more important thing is there may also be mediastinum may shift away from the so if this is the mediastinum, because of these contents and because of the lung is already compressed by these contents, even the mediastinum may also shift away from the contents. So here the mediastinum may also be shifted away from the side of the hernia. And one more thing is polyhydramnios may be seen from the obstructed stomach. Due to obstructed stomach, the patient might also develop polyhydramnios. Why is stomach obstructed? Because the stomach and all the structures are present in the thorax. There is less room in the thorax, so as a result there will be compression of the thorax leading to obstruction, so resulting in polyhydramnios. Why? Because in the during the uh, intrauterine life, the baby swallows the or drinks the amniotic fluid, and it excretes the the urine is excreted, and urine is nothing but the amniotic fluid. Urine of the baby is amniotic fluid, and that amniotic fluid is drunk by the baby, it is swallowed by the baby. But because of the obstructed stomach, the baby cannot swallow more amniotic fluid because of this obstruction, but the production of amniotic fluid or production of urine is normal, and as a result there will be increased amniotic fluid or polyhydramnios is seen in the child. Then sometimes the child may also develop pneumothorax may be seen on the contralateral side of the congenital diaphragmatic hernia. Pneumothorax can occur opposite to the congenital diaphragmatic hernia. So with these findings, we can diagnose the patient with congenital diaphragmatic hernia.
thank you and thank you for watching.